Hi everyone, my name is Elise Pham and I am a biology and neuroscience major and public health minor. For my thesis, I decided to study attitudes towards seeking out mental health care among students at SCU. Asian Americans underutilize mental health resources compared to members of other racial groups. They are 3 times less likely to seek mental health help than white Americans. Mental health service utilization has been linked to a person's attitudes towards receiving mental health help, but many Asian American communities tend to dismiss mental health. Studies have identified cultural barriers as a contributing factor. There aren't many studies that have examined the mental health indicators and health-seeking behaviors of Asian Americans, and there are even fewer that have studied this in Asian American college students. The purpose of this study is to investigate whether mental health symptoms, experiences, and attitudes of Asian students differ from white students. We will examine factors such as demographic characteristics and cultural values associated with the symptoms and help-seeking attitudes among Asian students. These are my hypotheses. I hypothesized that Asian students would have less positive attitudes towards using mental health services compared to white students. I also hypothesized that a smaller percentage of Asian students would report help-seeking experiences compared to white students. And finally, greater adhesion to Asian cultural values would be associated with lower mental health help-seeking attitudes. I created an online survey questionnaire through Qualtrics that contained questions about demographic characteristics, mental health symptoms, help-seeking attitudes, and help-seeking experiences for mental health concerns. I recruited my participants through convenience sampling, and I reached out to professors within the public health and ethnic studies departments to distribute my surveys to their students. I ended up with 64 participants, all of them undergraduate students at SCU. And I analyzed my data using SPSS and R. These are the measures that I used to quantify symptoms, attitudes towards help-seeking, and Asian cultural values. To evaluate formal and informal experiences with help-seeking within the past year, the survey asked participants to identify whether they had a visit with a mental health professional about a mental health difficulty. It also asked them to identify whether or not they talked to a non-professional, such as a friend or relative, about a mental health difficulty. And these are my results. The results of this study provides insight into the unique mental health experiences of Asian students at SCU. We found that compared to white students, Asian students held significantly less positive attitudes towards seeking help for their mental health concerns. We also found that compared to Asian students, white students reported a higher rate of formal help seeking, 60.7% versus 30.6%. A higher rate of informal help seeking, 89.3% versus 77.8%. And we can also see within the Asian American group that these Asian students were more comfortable seeking out informal help than they were with formal services, such as a psychologist or a school counselor. We also found that among Asian participants, cultural values weren't associated significantly with symptoms or help-seeking attitudes. We performed a series of regression analyses, and we found that among the Asian students only, Asian female students reported a significantly greater number of symptoms compared to Asian male students. So although Asian cultural values did not affect symptoms or attitudes, it seems that gender plays a significant role in symptoms only. And so the results of this study provides insight into the unique mental health experiences of Asian students at SCU, and it affirms that some national trends in Asian American mental health are also present at SCU. Asian students experience and perceive mental health care differently from white students as evidenced by less positive attitudes towards help seeking and a lower rate of formal or informal help seeking experiences. We also see that while cultural values weren't associated with symptoms or help seeking attitudes among the Asian students, Asian female students have significantly more symptoms than Asian male students. One limitation of the study is that the small sample size impeded the precision of these statistical analyses. In addition to reaching a larger participant pool, future research could focus on exploring which other factors, if not cultural values, may contribute to the differences we see between Asian and white SEU students in this study. Overall, this study brings us one step closer to understanding how we can better support the mental health of Asian students at SEU.